So there's a concept in obstetrics or pregnancy delivery. So they usually, you hear medical professionals just abbreviating is EDDD. EDD, sorry. So it just simply means estimated due date. So if I ask you, guess what estimated due date? They're just trying to calculate a possible day that you give birth to your baby. Okay? So you're trying to know like a possible date. So once that date passes, they're now trying to say that your pregnancy is becoming too long. So it helps you to know if the pregnancy is going rightly, you know. So in obstetrics, the estimated due date is a projected date when spontaneous labor is supposed to be expected to begin, all right? And essentially, you are trying to look at when the baby is likely to arrive. Okay? So how is it calculated? Very important, so that mothers can even calculate their own for themselves. We have different rules that help in this calculation. We have the Naegele's rule, most commonly method. So usually add 280 days to the first day that the woman had her last menstruation period. So the woman helps us in this aspect because they usually ask you, what was the last time you had menstruation? So you don't know, right? You don't know that you are giving the doctor a lot of tips about when you give birth. Okay, so that's what works there. That's a Naegele's rule. Okay, so you assume a regular 28-day cycle with ovulation on day 14th, like ultrasound dating, especially accurate in the first trimester up to 13 weeks and 6 days. It measures the fetal size, to estimate gestational age of the baby and the due date. It measures how big the baby is becoming. This will now help you to know when likely the baby will come out using ultrasound. Then assisted reproductive technology, that's IVF or embryo transfer, is based on the embryo's age and transfer date. So this one you are transferring, is very much more accurate. So pregnancy wheels and calculators, these are different tools that people have developed, just to help you know when the baby will come out. It's kind of like a wheel. So why does it matter? It helps to guide prenatal care, right? Monitor fetal development and plan for delivery. Planning for delivery include even gathering the money for that. Okay, so you hear some people, they are trying to give birth and there's no money. Okay, so adjustment may be made if early ultrasound findings differ significantly from the last menstrual period based on estimates. Okay, so these are the different ways we can be able to estimate the due dates and try to know when we are expecting a baby to come through.